Hello, and welcome to our webinar, Understanding Medicare. This webinar is part of VWG Wealth Management's Your Life series, a series dedicated to helping our clients learn more about the financial topics that impact their financial lives. I'm Christina James, a certified financial planner and wealth advisor at VWG. Today, we are talking about Medicare. I have a special guest joining me, Dave Lastman. Dave is the founder and president of Senior Healthcare Team. Dave and his team are independent Medicare specialists, and they help clients navigate the Medicare maze and select the plan and options that work best for their needs and budget. As financial advisors and fiduciaries for our clients, we are often asked questions about Medicare. Medicare can be overwhelming with all the different plans and options available. Without further ado, I would like to go ahead and turn things over to Dave Lastman to help us get a better understanding of Medicare. Dave?
Well, thank you, Christina, and I appreciate the opportunity to serve as a resource for anybody listening. And my goal today is to help unravel some of the mysteries of Medicare. Medicare is a great program. Unfortunately, there is so much misinformation out there that people base this really important decision that affects their health care off of. And when it's explained properly, people can choose something that fits their needs and their budget based on accurate and unbiased information. With that being said, the focus on this is to help people understand how to best cover all of the gaps that Medicare does not cover so that they have the most complete, comprehensive, full health care coverage. And when it comes to Medicare, you do have choices. That being said, let's start out and talk about what is Medicare. Medicare is a federal program. It was created in 1965, and it's for people that are 65 or older and some people that are under 65 that have certain disabilities. There's currently 60 million Americans on Medicare, 10,000 people a day turning 65, all of the baby boomers. If you're already on Medicare or if you're 64 and you're approaching that age, we're going to give you the ammunition that you need in advance so you can plan for that transition in the easiest and most effective way. Some of the questions that we're going to go over is, what is original Medicare and are there other health care options? What do the parts of Medicare mean? You hear these letters A, B, C, and D. We're going to tell you what they mean, what they do. What are the differences between Medicare and other health coverage? There are different types of Medicare plans, and there are also employer plans, retiree plans, VA coverage, so we're going to touch on that. And is original health care enough coverage for me? How are my prescriptions covered? How much is it going to cost? What are the deadlines for enrollment? Let's start with the parts of Medicare. Medicare Part A is your hospitalization coverage. This is what covers you when you're formally admitted as an inpatient in the hospital. Everything other than being admitted into the hospital as an inpatient is covered by Medicare Part B. That's your medical insurance. This is where it gets a little bit confusing. You have something called Medicare Part C, which is not part of original Medicare. It's a substitute, and we're going to touch on that a little bit later. And the last piece is Medicare Part D, which is your prescription coverage. You can think of Part D as in drugs. That's your drug plan. I've got a little exercise that I have people do to help them visualize how the parts of Medicare work. And so if you have a piece of paper available, you can play along with me. And
I've got my paper out.
Okay, perfect. Grab your paper and draw a line down the middle of the page, separating it into two vertical columns. On the top left-hand corner, write Part A, hospital stays.
Okay.
Below that, write a dollar amount, $1,364, and then below that, 80%/20%. And I'm going to explain all this in a moment, but let's go to the top right-hand corner and write Part B and the words everything else. Below that, you're going to have another dollar amount, $185, and then below that, 80%/20%. Let's talk about Medicare Part A. Your hospitalization coverage. This covers you as an inpatient in the hospital. It also covers skilled nursing facility care, hospice, and home health care. Remember the $1,364 number that I had you write down? That is your Part A, or your hospitalization deductible. The way it works is it's a per occurrence deductible. So each time you're formally admitted into the hospital as an inpatient, you're required to pay a $1,364 deductible from your pocket before Medicare pays anything.
That's a lot.
It is a lot, and I'm going to show you how you're not going to have to worry about that in a little bit, but I want you to understand how Medicare alone works, and then we'll talk about adding a supplement to cover the gaps. But you would be required to pay a $1,364 deductible, and this is a per occurrence deductible. So that means, let's say you go to the hospital because you break a bone and you're in the hospital for a couple of days, and then you come back, within the next 2 weeks for a heart condition. That's a different occurrence, and you're required to pay an additional deductible. So let's talk about Medicare Part B. Medicare Part B is your medical insurance. It covers everything outside of the hospital. This would be things like your regular doctor's visits, specialist, outpatient surgeries, things like MRIs, CAT scans. It even covers lab work, blood work. It covers diabetes testing strips and equipment, which would fall under durable medical equipment. So even things like a CPAP machine, if you have sleep apnea, hospital beds, pretty much everything else other than being an inpatient falls under Medicare Part B. Now, the $185 number that I had you write down, that is your Medicare Part B deductible. This is a little bit different. It's not a per occurrence. It's an annual deductible. So once you've paid $185 from your pocket in each calendar year, Medicare will then go and pay 80% of all of your bills, and you're responsible for 20% for the rest of the calendar year. So as you see, there are gaps. 20% of an unknown number can be huge. And if you had a heart attack and it was a $100,000 bill and you're responsible for 20%, that would be devastating for just about everybody. So the rest is your responsibility. And there are ways to cover those gaps, that some or part or all of that 20%, so you don't have to come out of pocket. And this is what I want to focus on this webinar. One option to cover the 20% gap is adding a Medicare supplement plan. And you may have heard the term Medigap. Those are synonymous. They mean the same things. There are 10 different types of Medicare supplement plans. Some of them are more valuable than others. So you really should understand how they work and choose your plan efficiently. Before we start looking at the Medicare supplement plans, I just wanted to touch on some terminology to make sure that everybody understands. And what those supplement plans do is they help cover some or all of the costs that aren't paid directly by Medicare, which would be coinsurance, co-payments, and deductibles. A coinsurance is when you split the cost on a percentage basis, like an 80%, 20% split. Medicare pays 80%, you're responsible for 20%, that is your 20% coinsurance. Then you have costs called a co-payment. Christina, that's like when you walk into the doctor's office and you pay $30 right off the bat before you even see the doctor. That's a copay. And then deductibles, and we were talking about the Part A deductible, the Part B deductible. That's a preset amount that you have to pay before Medicare starts to pay. So now that we have the terminology down, this is a chart of all of the Medicare supplement plans for 2019.
That is overwhelming.
It is overwhelming, and it's confusing, but here are the things to focus on. Any of the spaces, if you look over on the right column, you see Plan A, not to be confused with Medicare Part A. And you'll see the only box that is filled in are the basic benefits. That's the first 60 days in the hospital. Everything else is blank. That means you're responsible for all of these blank spaces. You look at the second plan, and it's the same. It just includes basic benefits, but it also covers your Part A deductible, the $1,364 number. Most of these plans are very limited. I want you to just focus on the two plans in the middle because they cover just about everything that Medicare doesn't cover. This is Plan F on the left and Plan G on the right. And if you notice, the only difference between those two plans is that Plan G does not cover the $185 Part B deductible. That is your responsibility. Once you've paid that deductible, Plan F and Plan G are exactly the same. They pick up everything that Medicare doesn't pay. Hence, you have 100% coverage. And I want to go back and show you how that works with Medicare Part A and Part B. So if you go back to your paper that I had you write down, if you look on the bottom, if you find any blank space, write down Plan G.
Okay.
And next to that, you write the words 100% covered. Maximum out-of-pocket equals $185. And here's how this works. Remember the $1,364 deductible for Part A? Plan G covers 100% of that. As long as you have added Supplement Plan G with your Medicare, you're not going to be responsible for Part A. So you can go ahead and cross that out.
That's huge.
It is huge. You can cross out the 80%. 80% of the bill is going to be paid by Medicare, so you're not going to be responsible for that in the hospital. And the 20% of any medical bills in the hospital, which would normally be your responsibility, you can cross that out as well because Plan G covers all of that. So in the event that you are ever hospitalized as an inpatient, no matter how big the bill is, if you have a Medicare Supplement Plan G, you're not going to have to pay not 1 cent out of pocket. Okay? Now let's go over to the Part B side. Remember the $185? That's the Part
Yes.
B deductible. Go ahead and circle that. You're going to pay that. After you pay that, Medicare will pay 80% of all your bills. Remember, this is everything outside of the hospital, your doctor's visits, lab work, testing, checkups. The 20%, which would normally be your responsibility, go ahead and cross that out too because Plan G covers that as well. So a good way to look at this is as long as you have Plan G, your medical bills for the year are never going to cost you more than $185 out of your pocket.
Wow.
Well, the last piece,
Can I sign up for Medicare now?
you've got a little ways to go.
A little too young, but $185 a year beats what I pay now for medical bills.
And it beats the individual plan that I have as well. And this is one of the benefits. I mean, when you work and you pay into Social Security, these are the advantages that you have to take advantage of when you turn 65. You've earned this, but there are different types of plans, and sometimes people choose a lesser plan that has more limitations and doesn't cover 100% of their bills. So we want to make certain that people understand that they have this option to pay nothing when they use the doctor or the hospital. The last piece of the puzzle is Part D, which is your prescription drug plan. This is a standalone coverage. It's not included in the Medicare supplement, so you actually have to choose a prescription drug plan. This will help cover the cost of your prescription drugs. They're run by Medicare-approved private insurance companies, and they help lower your prescription drug costs to protect against higher costs in the future. Medicare requires that you must be enrolled in some sort of creditable prescription drug coverage, or they penalize you for the amount of time you went without drug coverage, and that penalty lasts forever. So you want to make sure that you enroll in a drug plan when you're first eligible. Even if you take no prescription drugs, you want to choose the least expensive drug plan to avoid that penalty. Here's where things get a little bit confusing. Medicare Part C, which is called Medicare Advantage, also called Medicare Replacement Plans, is not Medicare. It is a substitute or an alternative for Medicare. I would say the vast majority of people who are on Medicare Advantage plans think that they have Medicare. They don't. They have opted out of Medicare, and chosen a replacement plan that has some of the features of original Medicare, but it has a lot of limitations. They typically will have lower monthly premiums, but more restrictions and more out-of-pocket costs when you use your plan. These are typically run like an HMO, sometimes a PPO. They include some of the benefits covered under Part A, some of the benefits covered under Part B. But it's important to know that these plans, they're private insurance companies, they set their own rules and guidelines. They don't have to follow the rules and regulations of Medicare, which is very highly regulated. And so you run the risk of essentially these companies make the rules and you have to play by them. They typically will bundle in some sort of prescription drug coverage as part of the plan, and might include some extra benefits like dental and vision included or for an additional cost. So we talked about the gaps in coverage. You basically have two options. Option one is you stay with original Medicare. You add a supplement to cover everything that Medicare doesn't cover. Or you choose Medicare Advantage and you opt out of original Medicare and you're in the Medicare Advantage plan. You can't get an Advantage plan with original Medicare. You can't get a supplement if you have an Advantage plan. It's one or the other. Again, the Advantage plan is a substitute to Medicare. You give up, you forfeit your Medicare coverage that's run and protected by the government, and instead you opt into a managed plan with limitations. And I'm going to run through this. I know we're a little bit tight on times. Some of the drawbacks to Advantage plans are you have a restrictive network of doctors and hospitals. You can only go to the doctors that are in your particular plan's network, or you're going to pay out of pocket. The coverage is typically local, maybe regional, that you typically don't have national coverage on these Advantage plans. Your provider may leave the network at any moment, or your plan can be canceled, and then you'll have to either pay out of pocket to go to your doctor or find a new doctor that doesn't know your medical history. You will typically always pay some sort of a co-payment to your doctor, usually more for specialists. They require you to follow strict rules to get coverage, like having to go to your primary care doctor and then get a referral before you could see a specialist, sometimes having to get pre-authorizations. Again, the insurance company sets the rules. They change them all the time. They change their guidelines. They change their networks. They change their approval policies. And the health plan decides what tests and procedures are approved for you, as opposed to you deciding what tests and procedures are best for you. You'll typically see higher out-of-pocket costs with these plans, sometimes, excuse me, $6,700 or more per calendar year before you're fully covered. And I'll give you a story of one of my clients who came to me that had an Advantage plan. We were able to move her off of that and onto a supplement. But she had she'd been diagnosed with cancer late in the year, around November, started treatment, and her treatment continued into January of the next year. She had reached her out-of-pocket maximum for the 1 year, and then right at the beginning of January hit her out-of-pocket max for the second year. So she had like a $14,000 bill back-to-back that she was responsible for. The other limitation, yeah, I know, it's you know, I want people to know this on the front end so they don't get stuck in a situation like that.
Right.
These plans, the Advantage plans, also lock you in, and you can only make changes between October and December, and those changes take effect the following January. And you can only change your plan if you can, if you're healthy enough to pass medical underwriting. So there's a lot of risks that maybe you start on an Advantage plan, you don't like it. You got to hope that you can get to October and not have any medical issues in order to get out of the plan. Why would somebody choose a Medicare supplement plan over a Medicare Advantage plan? You can keep or choose any doctor that accepts Medicare patients, which is the most widely accepted insurance in the country. Over 97% of all hospitals, providers, and doctors accept original Medicare. You can see any specialist without a referral. Your coverage is national. It doesn't matter if you're in McLean, Virginia, or Sheboygan, Michigan, or Juneau, Alaska, or even Guam. You're covered anywhere in the U.S. the same as you are in your home area. Some offered low or no copays and help paying some or all of the deductibles. Your coverage is guaranteed for life. You can never, once you're approved for a Medicare supplement plan, your benefits cannot change and you cannot be dropped or declined coverage for any reason other than failure to pay your premium for life. You can change your plan any time of year. If your rates go up on a plan, you're not locked into the end of the year. You can change any time that you want. What this means is by adding a supplement plan, you can eliminate all of your deductibles and coinsurance. The plans are standardized by the federal government, and I want to focus on this. What that means is that a Plan G is a Plan G is a Plan G. Doesn't matter if it's with Company A, Company B, Company C. There is no difference at all other than the premium that they charge you. Different insurance companies will charge different premiums for the exact same coverage. So Plan G with one company is exactly the same as Plan G with any other company. So you always want to look for the least expensive rate for the plan that you want in your zip code. Going back, the two most popular plans, Plan F and Plan G, the only difference is with Plan G, you directly pay the $185 Part B annual deductible. With Plan F, they pay it for you, but they charge you a much higher monthly premium to do so. So it's just a better value. They all have the same exact benefits. There's no better benefit under Plan F than Plan G. Since the premiums for Plan F are higher, Plan G has a better value, and they've also kept their rates lower historically over time. Here's a quick little graph of Plan G rates, which is the blue line over time, and the Plan F rates. Plan F has been increasing their premiums at a much steeper rate than Plan G. That being said, as of January 1st, 2020, Medicare is going to no longer let new people turning 65 into Plan G. What that means is, to Plan F, my apologies. Plan F is going to be going away for new people. So what that means is if somebody has Plan F already, they can keep it, but what happens with insurance rates is you have older, sicker people paying expensive claims on one end, and then you have younger, healthier people that are basically paying their premium and not going to the doctor very often, and that's what keeps rates low. So when they stop letting the younger, healthy people into Plan F, you're just going to have smaller and smaller pool of people getting older and sicker, and the rates are anticipated to skyrocket. So Plan G in almost any area is going to be the better value. I'm running a little bit tight on time, so quickly I'm just going to talk about when to enroll. You can enroll into a supplement plan up to 6 months before the month you turn 65. Typically, that's when you're going to get the best rates. The closer you get to your birthday, the more the rates will tend to go up. When you are enrolling in Medicare for the first time, you have the right to buy any supplement plan, guaranteed approval. They can't look at your medical history or your prescription history, and the coverage is guaranteed for life. The last thing I want to talk about is something called IRMA. The Medicare Part B premium that you pay is $135.50. That's the standard premium. But if you make more than a certain amount of money, they have the right to adjust your premium up based on your income. It's called IRMA, Income-Related Monthly Adjustment Amount. So if you see on this chart, if your joint tax return, your modified adjusted gross income was $170,000 or less, you'll pay the standard premium, which is $135.50. If you make more than $170,000 up to $214,000, it's increased up to $189. You'll see the next little tranche is up to $267,000 modified adjusted gross income. It goes up to $270,000. The highest premium that you'll ever have to pay for Part B is $460, and that's if your modified adjusted gross income was $750,000 or above. With that said, Christina, do you have any questions about anything?
I do, but thank you so much, Dave. You really helped break down Medicare. I do have a few additional questions that I'd like to get your perspective on. First, I hear about these special enrollment periods. Can you tell us a little bit more about them?
Sure. So Medicare Part B, when you're first eligible for Medicare, it starts the first month of the month that you turn 65, right? But as long as you
What a nice birthday treat.
it is a nice birthday treat. And that's when you have this guaranteed approval where nobody can look at your health and your coverage is guaranteed forever. Now, if you keep continuous credible coverage, for example, if you have employer coverage, if you have a retirement plan, then you can defer going on to Medicare Part B until you're ready to come off of that plan. And when you do so, yeah, go ahead.
So if I were working at VWG, for instance, and I was continuing, I said I wanted to work until 67, and I stayed on VWG's private health insurance, then at 67, I could get onto Medicare because I would have lost my continuous coverage.
Right. So this is really important. If you have coverage through an employer with 20 or more employees, 20 or more, then you do not have to enroll in Medicare Part B. You can defer until you're ready to come off of that group plan, and it'll be just like you're turning 65, guaranteed issue, no penalties. However, if your employer has less than 20 employees, you must sign up for Medicare Part B when first eligible, and that's very important.
Oh, good to know. Thank you. Are there any other special enrollments?
Yeah. Anytime you're still covered by the group health plan, then you have a special enrollment period during the 8-month period that begins the month after your employment or coverage ends, whichever happens first. Coverage based on your current employment does not include COBRA. It does not include VA coverage. It does not include retiree coverage or individual health coverage. So if you're in one of those situations, you must enroll in Medicare Part B when you're first eligible, or you will be penalized. And more importantly, your group plan is primary to Medicare. I'm sorry, Medicare is primary to the group coverage. So a scary situation is, if you thought that Medicare was going to pay first and you have group coverage and you never enrolled in Medicare Part B and you look to your employer's coverage, they're not going to pay until Medicare pays first. And Medicare's not going to pay because you never enrolled when first eligible. And that's a really sad and sticky situation when somebody, when that happens to somebody. And unfortunately, I've had that happen multiple times to people that I know.
Well, it sounds to me that people just need to plan ahead, and if you've got your 65th birthday coming up, someone should reach out to, a specialist like yourself, about 6 months before their 65th birthday. Certainly you also want to work with VWG as part of your financial plan, but when should people reach out?
They really should about 6 or 7 months before they turn 65. If you have somebody that you're working with, take everything that, when somebody calls you that's selling insurance or works for a specific company, take it all with a grain of salt. We have a lot of unbiased Medicare tutorial videos on my website, which is medicaredave.com. You can always feel free to reach out to me if you have any questions. But the goal is everybody's got different needs, different budgets, different situations. Even if you're already on Medicare, it's always a good idea to review your current coverage year to year. Just make sure you still have the plan that best fits your needs and you're not overpaying for what you have.
Yeah, that's good advice. Something I've heard a few times, and my clients have asked this, they've said, what's the difference between long-term care and Medicare? I've got Medicare. I don't need long-term care. Is that true?
No, Medicare covers all of your current hospitalization needs. Long-term care covers custodial care. That's like, when you need full-time help with activities of daily living, if you need to go to a nursing home full-time. So if you have long-term care, you definitely want to keep that, but it's not a substitute for Medicare.
Okay, very good to know. And then I always have to quickly look it up. What is the difference between Medicaid and Medicare?
Sure. Medicare is a federal program for people that are turning 65, people that are 65 and over, and certain people with disabilities under 65. Medicaid is a federal and in most cases a state regulated program for people with low income. So that's that's Medicare health insurance coverage for people that fall below certain income thresholds and can't afford coverage on their own.
That's where VWG comes into play. We're really hoping that our clients don't ever qualify for Medicaid, hoping that, with the right financial planning and investment management, they don't ever have to worry about meeting those thresholds. Well, Dave, thank you so much. This was really great information, and thank you for taking the time to show us all the different components of Medicare. I know it can be just very confusing and overwhelming. There's so many rules around it. I hope that all of our listeners found today's webinar beneficial. If you would like to receive a copy of Dave's Medicare checklist, please reach out to your VWG advisor or to Delaney Taggart at VWG. At VWG, we believe in holistic financial planning because it empowers you and allows you to make the best financial decisions for you. Your Medicare coverage is just one decision that should always be made as part of your overall financial plan. So if you haven't done a financial plan recently, make sure you're reaching out to VWG to help with that. And thank you for joining us today, and please reach out to VWG Wealth Management if you have any questions. Have a great day, and thank you.